It's a story we were first to bring you right here on WIAT 42 News. Groundbreaking research on diabetes at UAB. Good evening, I'm Sherry Jackson.
And I'm Trent Butler. Welcome in. Today, people with diabetes from across the country are reacting to the big news that UAB researchers have cured diabetes in lab mice. WIAT 42 News reporter Lillian Lalo joins us live at UAB, where researchers are getting ready for clinical trials on humans. And Lillian, major news, promising news for a lot of people, and those people want to know, when will those trials begin?
Well, those trials are going to begin in January right here at UAB, and they're going to be testing a common blood pressure medication. It's actually called verapamil. Now, what's different this time is that it's not just treating the symptoms of diabetes, they're actually reversing the disease.
Daphne Powell's fingers are scarred from 35 years of checking her blood sugar with her glucometer.
It hurts. It's, kind of painful.
She was diagnosed with type 1 diabetes in 1979. All those years worrying about keeping her blood sugar level not too high and not too low.
So these two fingers take the brunt of the damage.
After a successful UAB study cured diabetes in lab mice, Powell says she has a renewed sense of hope that one day she'll never have to prick her fingers again.
And it's just thrilling to know that we are that close. It's so very close.
Powell has been seeing Dr. Fernando Ovalle at UAB since 1999. Ovalle is the co-principal investigator in the human trial of the study alongside Dr. Aneth Shalev.
And I think we're about to find the potential ways to cure the disease.
Several studies in the past have targeted treating the immune system. This study is different.
We're trying to rescue the insulin-producing cells of the pancreas, which we call the beta cells. And they tend to die over time in people with type 1 diabetes.
I told Dr. Ovalle, the principal investigator, a few years back that he has 10 years to cure me. He asked me for 20, but I told him I was holding it to the 10. I really think he's trying to meet that goal.
I am very confident that we're going to have something that is going to really change the way we treat diabetes and perhaps cure diabetes within the next 10, 15 years.
Now, Dr. Ovalle says that all diabetics, including people with type 2 diabetes and those with insulin resistance, can potentially benefit from this study. And again, those trials are going to begin in January. Sherry?
Lillian, it's really fantastic news. I'm sure a lot of people watching, though, tonight are interested in this. How can they qualify and sign up for the clinical trial?
Well, they're actually kind of concerned that they're going to find people to qualify for the trial because it's a narrow window. You have to be between the ages of 19 and 45, and you have to be newly diagnosed with type 1 diabetes within the past 3 months, ideally. Now, if you think you might qualify, or maybe you know someone who qualifies, there is a number that you can call. That number is 934-4112. Now, we also have all of this information posted at WIAT.com. Live in Birmingham, Lillian Lalo, WIAT 42 News, coverage you can count on.